Examples of upper and lower respiratory infections. Upper, croup, epiglottitis. Lower, acute bronchitis, pneumonia. Croup aka, age, etiology. AKA ALTB acute laryngotracheobronchitis. Age 6 months to 5 years. Etiology parainfluenza virus type 1 most common but type 3 most severe. Clinical features of croup. Running nose and cough which progress to barking cough in 3 days, narrowing of larynx stridor and narrowing of trachea and bronchi wheeze. X-ray finding of croup. Steeple inverted V sign subglottic narrowed air column. Management of croup. Self-limiting, mild croup, oral dexamethasone. Mod to severe, dexamethasone plus O2 plus nebulized racemic epinephrine. Acute epiglottitis age etiology. Age 3 to 6 YRS. Etiology, bacterial Haemophilus influenza B. Streptococcus pyogenes. Streptococcus pneumoniae. Clinical features of epiglottitis. Severe airway inflammation, emergency. High-grade fever, stridor, 3Ds dysphagia, drooling of saliva, dyspnea. Investigation and findings of epiglottitis. X-ray, thumb sign, soft tissue shadow of epiglots. Laryngoscopy finding, inflamed cherry red epiglottis may cause laryngospasm if stimulated by laryngoscope, hence not done routinely. Management of acute epiglottitis. Secure airway intubation, tracheostomy. IV antibiotics, ceftriaxone, cefotaxime. Acute bronchitis age and etiology. Age less than 2 year. Etiology, RSV, respiratory syncytial virus. Pathology of acute bronchitis. Inflammation of bronchioles, causes edema and more mucus. So, airway obstruction and airway narrowing. Clinical finding in acute bronchitis. Clinical findings. DT air trapping, up-pointing arrow AP diameter, hyperresonance on percussion. Wheeze DT narrowing of airway. X-ray sign in acute bronchitis. Parabronchial cuffing DT inflammatory exudate. Bilateral hyperinflation. Management of acute bronchitis. Supportive management, moist O2, fluids, antivirals. Prevention PALIVIZUMAB. Pneumonia what an etiology. Infection of lung parenchyma, etiology, streptococcal pneumonia, E. coli, GRPB streptococci. Viral RSV. Clinical features of pneumonia. Fever, wet cough, tachypnea, crepitations. Community management guidelines of pneumonia are given by IMNCI Integrated Management of Neonatal and Childhood Illnesses. Color-coded classification of pneumonia and features. Green no pneumonia fever cough. Yellow some pneumonia, fever cough plus fast breathing plus SPO2 normal. Pink, severe pneumonia, SPO2 less than 90, plus any danger sign, lethargy, not feeding, convulsion cyanosis. Treatment of various classes of pneumonia. Green, at-home PCM. Yellow, PCM plus amoxicillin 5 days. Pink, IV ampicillin plus gentamicin. Fast breathing criteria. Less than 2 month greater than 60 per minute. 2 to 12 month greater than 50 per minute. Greater than 12 month greater than 40 per minute. Pneumococcal pneumonia features. Decreased air entry, crepitations, lobar consolidation, on chest X-ray. Sputum, if expectorated, rusty. Bronchial sounds. Dull, impaired note on percussion. Treatment of pneumococcal pneumonia. Penicillin G 50 kIU per kilogram per day IV. If not available, IV ceftriaxone, cefotaxime. Staphylococcus pneumonia etiology. Cystic fibrosis recurrent pneumonia. Secondary to viral infection, measles, influenza etc. Spread from a different focus of infection, pyoderma, skin. X-ray findings in Staphylococcus pneumonia. 1. Pneumococcal pathognomic, air-filled cystic spaces which can cause pneumothorax. 2. Bilateral patchy consolidation empyema, or purulent pericarditis. Treatment of Staphylococcus pneumonia. Amoxicillin plus clavulanic acid, or ceftriaxone plus cloxacillin, if suspected MRSA vancomycin. Primary atypical pneumonia organism, age, features. Organism, Mycobacterium, age greater than 5 years. Features, low-grade fever, cough, scattered crepitations, hemolysis. Primary atypical pneumonia investigation and findings and treatment. Investigation, on X-ray interstitial pneumonia seen. Cold agglutination test positive, IgM against RBC seen. Treatment, azithromycin, erythromycin.